Welcome to eCareDiary.com's Caregiver Tips and Clips. I'm your host Meghna Giridhar. Each week we will focus on a caregiving issue in the form of a short educational video. The subject of today's video is psoriasis. Psoriasis is an autoimmune disease that causes raised red scaly patches to appear on the skin. It's associated with other serious health conditions such as diabetes, heart disease, and depression. Psoriasis is not contagious and lesions are not infectious. Normally, skin cells grow gradually and flake off about every 4 weeks. New skin cells grow to replace the outer layers of the skin as they shed. But in psoriasis, new skin cells move rapidly to the surface of the skin, build up and form thick patches called plaques. Men and women develop psoriasis at equal rates. About 1.3% of African Americans have psoriasis compared to 2.5% of Caucasians. It often develops between the ages of 15 and 35, and about 10 to 15% of those with psoriasis get it before the age of 10. Psoriasis can show up anywhere. Scalp psoriasis can be very mild with slight, fine scaling or severe with thick crusted plaques covering the entire scalp. It can extend beyond the hairline onto the forehead, the back of the neck, and around the ears. Facial psoriasis most often affects the eyebrows, the skin between the nose and upper lip, the upper forehead, and the hairline. Hands, feet, and nails are other areas that are also affected. The most common type of psoriasis in the genital area is inverse psoriasis, but other forms can also appear on the genitals, especially in men. Inverse psoriasis can occur in skin folds such as armpits and under the breast. This form is frequently irritated by rubbing and sweating. There are no special blood tests to diagnose this condition. A skin doctor will examine the affected skin and may take a piece of the affected skin for a biopsy. Your doctor will also want to know about your family history, since 1/3 of people with psoriasis have a family member with the disease. Light therapy or topical treatments are often used when it's limited to a specific part of the body. Oral or injectable drugs will be prescribed if the psoriasis is widespread. Most of the time, psoriasis can be treated at home since most cases are mild. Skin care is crucial when it comes to treatment, and it always begins with skin care. This includes keeping your skin, scalp, and nails moist with creams and lotions. For mild symptoms, over-the-counter products such as aloe vera may be soothing. There are also many psoriasis creams, ointments, and shampoos that you can buy without a prescription. Certain medicines can trigger psoriasis, so it's best to consult your doctor about this and avoid them. Keeping alcohol consumption limited to 2 drinks a day for men and 1 for women can also help. In addition, eating a balanced diet and maintaining a healthy weight can go a long way. Some other tips include limiting exposure to bright sunlight, avoiding scratching of the skin. Injuries to skin can cause psoriasis patches to form anywhere on the body, including the site of the injury. Stress and smoking may also cause psoriasis to appear suddenly, so it's best to find ways to avoid. Coping with psoriasis can be a challenge, especially if the disease covers large areas of your body. However, getting educated, following your doctor's recommendations, and joining support groups can help those affected live a quality life. Thank you for joining us today. To access more caregiver tips and clips, visit us at www.ecarediary.com. Until next time.